Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Before the pandemic, Montefiore Medical Center's emergency department, located in the Bronx, ranked among the busiest in the country. And with COVID-19 impacting Black and Brown lives here in the borough, it's no secret that people are now fearful of going to the hospital. However, to ensure the safety and wellness of their patients, Montefiore has been implementing new protocols and services. Joining us now to discuss is Jeffrey Short, Vice President and Chief of Staff at Montefiore Health System. Jeff, thank you so much for joining us today.
Hey, it's great to be here today.
Thank you. So first to start off, how are Montefiore facilities and ER rooms looking now compared to April when COVID-19 cases spiked here in the Bronx?
Yeah, so thankfully we're seeing many non-COVID-19 patients now. That's really what we're mostly seeing, thankfully. Elective surgery has returned. Patients are coming in to see their physicians, and our patients are returning to the emergency room. And we're encouraged because we see that they're starting to stop putting off care and they're coming in to see their physicians.
Right. And what steps is Montefiore taking in order to prepare for a possible second wave of COVID-19?
Yeah, so we took the opportunity as the surge started to subside to renovate many of our units. So we've restocked them, made any repairs that were necessary, repainting, repairing anything that needed to happen. We've also taken a lot of time to figure out what we learned. So we went through a lot during the surge, and so we've essentially gone back and said, okay, what worked really well? What are some of the areas where we could improve? And we're putting that all into our future plans and protocols. We're also continue to drive and lead the way in clinical trials, new treatments, and vaccine clinical trials in order to get to therapeutics and hopefully a vaccine very soon. We're also expanding our testing. So right now we have the ability to do virus testing at all of our campuses, or also patients can go to one of our 4 drive-up sites around the Bronx and Westchester. So we're really trying to prepare for a second surge if, God forbid, it comes. So we're paying very close attention to data locally, also patients that are coming in, and also looking around the country to see what's going on.
Right. Now, Jeffrey, when it comes to aftercare, are there any services for recovering COVID-19 patients? Please share what those services are and how they work.
Sure. So during the fight of the pandemic, we realized that we needed a way to take care of patients once they left the hospital, because there are a number of very serious symptoms and after effects of this horrible disease. So what our experts created was what we call the core clinic. So it's a COVID recovery clinic. And what we do is, after the patients leave the hospital, we call them up and we make contact with them, and we can help them if they have new symptoms that are arising, or they're dealing with old symptoms, if they have questions. And so patients can call in or be referred by their physician in order to see a physician, and we can treat them via in person or via telemedicine. The way a patient can be referred is either, like I said, either through their doctor or by calling 844-556-6683, extension 36.
Thank you so much for sharing, Jeffrey. Patients are afraid to visit hospitals for many reasons, including anxiety and the thought of possibly being infected with COVID-19. Can you please share the new steps and protocols that Montefiore has taken in order to ensure the safety of their patients and social distancing measures?
So our clinical experts have studied the best practices and combined that with everything that we've learned during the pandemic to come up with a set of protocols to keep our patients, visitors, and employees safe. And we're calling that COVID Safe Care. And so COVID Safe Care involves some key protocols. One is rigorous cleaning measures. We do frequent deep cleanings. We disinfect high-touch areas throughout the day. We also disinfect our exam rooms and all equipment between patient visits. We require all patients, all visitors, and all employees to wear masks. We're able to provide them if they don't have them. We're also facilitating social distancing, which is so important during the pandemic. We've adjusted the size of our waiting rooms. We've had fewer patients going through those waiting rooms at any one time. And if you walk through the hospital, you may notice there's different guides, stickers on the floor, again, just to help people recognize what 6 feet apart really means. We also have non-COVID treatment areas for patients, again, to keep them away from areas where there may be COVID positive patients. We're also doing regular screenings. Patients are screened before we schedule a visit, and then also the day of the visit as well. And we'll continue to update these protocols as we learn more, as new science comes out. Our whole goal is to keep everybody safe, or both our employees, our visitors, and our patients.
Right. Now, Jeffrey, for those patients who are still a little wary, can we discuss leveraging telemedicine during the coronavirus and how the Montefiore First app can be a good alternative for those who would rather not leave home at this time?
Of course, yeah. During the early days of the pandemic, many didn't want to come in to see physicians and they put off care. We had many canceled visits. So we rolled out our Monty First platform, and it enables our patients to do a virtual visit via video from the safety of their home. Now, we saw during the pandemic, we saw most of our patients through telemedicine. In fact, over 250,000 telemedicine visits in the last few months. And so the way it works is, if you're interested, if you call your physician's office, and if you don't have a physician, you can call 1-800-MD-MONTY or 1-800-636-6683 to get a physician. So speaking with your physician, if it's appropriate, they'll schedule a virtual visit. They'll instruct you either how to download the app on your phone, both Android or Apple, or join on your computer. And once it's scheduled, you can then join 10 minutes ahead of the visit, and your physician will come in. And I will just remind everybody, the first time you use with a new piece of technology, there may be some bumps, but it's just like the first time I use an airline kiosk. Once you've done it once, you probably will never want to go back. But the Monty First platform allows us, if you want to do a visit from home, you can.
Thank you for sharing, Jeffrey. To close, how can people get in touch with Montefiore? Please provide our viewers with a hotline again to call with COVID-19 related questions and concerns.
Our hotline is 833-311-SAFE or 833-311-7233. And there you can ask questions. We have a chat bot. We have different videos on how to deal with COVID-19. If you want to visit our website, it's covidsafecare.montefiore.org/COVID-safe.
Thank you so much, Jeffrey, for your time today and for sharing all the safety protocols being implemented at Montefiore Health System.
Thank you very much.
Folks, again, the Montefiore COVID Safe hotline to call with COVID-related questions is 1-833-311-SAFE. That's 1-833-311-7233. You can also visit montefiore.org for more resources and download the Montefiore First app to access telehealth services. We'll be right back.